Hi, everyone. This is Leanne Jones from the STS. I have about 2 minutes after the hour, so I think we'll go ahead and get started with today's webinar. Again, we are here for the STS monthly congenital heart surgery database webinar. On the call today, we have from the STS myself, Leanne Jones, the manager for the thoracic and congenital databases. We have Carol Crone, senior clinical manager for the STS national databases. We also have, let's see who we also have from the STS. We also have Jane Hahn and Addie Dolan joining us from our IQVIA team members on the call. We have Melanie, Joe, Jeanette, Jean. It looks like we have Rhonda as well. And I think we covered all of our IQVIA colleagues. Also on the call today, we have two of our congenital heart surgery database core group members, Leslie Wacker from the University of Michigan and Chastity Wellness of Phoenix Children's Hospital will be joining us today. For the agenda, I'll cover a couple of quick housekeeping items, provide an STS and as well as an AQO update. I'll turn things over to Leslie and Chastity, and they'll provide a quick informational educational session on double coding complications. And then I'll turn things over to Melanie and team to provide the IQVIA update. And then finally, we'll finish up with our Q&A portion of the webinar per usual. And again, just a friendly reminder to please submit any of your questions via the Q&A function. Alrighty, for our housekeeping items, just a reminder that the August training manual has been posted and is available out on the STS website for your review. For those that have submitted FAQs, you should have received a response from me. But just please note that any questions that were submitted last week, the core group has not yet had the opportunity to discuss those questions. So if you did just submit a question last week, again, I have not responded to those yet as we have not had the opportunity to cover those questions. We also have our new data manager webinar series starting this month. Our first webinar is scheduled for August the 27th at 11 a.m. Central Time. For anyone that may not be able to join that webinar, the series will be recorded and posted out on the STS webinars page, so you can share with any new data managers within your organization, or you can go back. It will be available for you to review. These sessions are beneficial for our new data managers. We'll be discussing how to access resources, how to use your software specifications, data specifications. We'll go over the training manual. We'll discuss the process for submitting clinical questions. We'll go over understanding the DCF, as well as we'll cover several other topics for our new data managers as well. I realize this information for the spring 2020 harvest update was covered last on our user group call last week, but I did want to touch on this information again for those that may not have been able to attend. As you know, when the 2020 harvest began, STS did not establish harvest deadlines, as we felt it was important to provide the data managers and surgeons with ample time to learn and use the platform. On August 5th, STS did notify the CHSD community. We alerted our data managers and surgeons of the plan for the spring and fall 2020 harvest. Due to the release date of the CHSD platform, the STS and the task force has decided that there would be one harvest for 2020. Since last week's user group call, several data managers have, have reached out to me directly in regards to what dates needed to be submitted for this 2020 harvest. There seemed to be some confusion. So there will be one analysis for the 2020 harvest. This analysis will cover a 4-year time period of July 1, 2016 through 6/30/2020. So just to clarify, participants should be submitting surgical dates up through June 30th of 2020 for this current harvest. Again, just a friendly reminder that it is not necessary to submit the entire 4-year analytic period. I know a lot of participants do like to submit the 4 years, but again, it's not necessary. We encourage you to not submit that entire 4-year analytic period if it's not necessary. So, for example, if you participated in let's say in the fall 2019 harvest and submitted data up through June 30th of 2019, and say you have not gone back and done any cleanup on that data that was submitted during that fall 2019 harvest. For the current harvest, you would only need to submit data for July 1, 2019 through 6/30/2020 for this current harvest. So you would only need to submit that 1-year time period. Again, that's if you have not gone back and cleaned up any of that data that was submitted during the fall 2019 harvest, then you would only need to submit data for 7/1/2019 through June 30th of 2020 for this current harvest. I hope that makes sense. I know a lot of data managers have a lot of questions regarding this. If you continue to have questions about the time frame that needs to be submitted for this harvest, please feel free to reach out to me and let me know. I'm happy to talk with you through that and answer any questions that you may have. So I hope that does help clear up some of the confusion. Also, in regards to public reporting, again, just a reminder that public reporting will resume in 2021, and the public reporting results are to include the data from this combined 2020 harvest. So again, please feel free to reach out if you have any questions regarding the current harvest period, surgery dates to be submitted, or if you have any questions regarding public reporting, please feel free to reach out to us. AQO, as you all know, is coming very soon. Our very first virtual AQO is being held September 29th through October the 2nd. The CHSD session is going to be held on Friday, October the 2nd. STS did release some early bird pricing for registration. These early bird prices are good through Monday, September the 7th, so we do encourage you to take advantage of these awesome prices prior to the deadline. As you can see, the member fee for AQO, if you're an STS member, the fee for the congenital session is $75. After September 7th, the price does go up to $150. The fee for non-STS members, the early bird registration fee is $100 for the congenital session, and then after September 7th, it does go up to $200. If you'd like to register for multi-days or all days of AQO, the early bird price is indicated there as $150 for members versus $200 for non-members. So again, we really do encourage you to take advantage of these early bird prices. And again, these are good through Monday, September the 7th. Please be sure to visit the AQO webpage for all things AQO. Here you'll find information, or find the request for justification letter, the overall objectives for AQO. You can get a glimpse at the preliminary program. There's a link to the registration, link to abstract submission. STS will also be offering continuing education credits this year for AQO. And also with this virtual platform, we'll be offering both on-demand and live sessions. There'll also be opportunities to ask questions throughout via the Q&A function throughout AQO. So if you have any questions about AQO, please feel free to reach out to Emily Conrad. Her email address is there on the screen. If you have any questions, again, Emily can be reached at econrad@sts.org. So we'd be happy to answer any questions that you have regarding upcoming AQO. Next, I'm going to turn things over to Leslie and Chastity to provide some education on an issue that many data managers have inquired about. I know that many of you do also reach out to some of our seasoned data managers for questions and guidance on certain issues. So I'm going to turn things over to Leslie to cover one of our topics regarding double coding complications. So Leslie, I'll turn things over to you.
Okay, thanks, Leanne. So Chastity and I were asked to just pick a topic that we thought we got more questions about, or got questions kind of often about, and we also see this through the core group, the FAQ portal as well, and that's this kind of feeling of double coding complications. So there are a few examples on the screen here of when it is appropriate for one event to kind of be coded using two different codes. One would be a tracheostomy. If you have that postoperatively, you're going to code both the respiratory failure code as well as an unplanned non-cardiac reoperation. Another example is if you're on ECMO postoperatively, you'll be coding the mechanical circulatory support as well as cardiac failure. And if you get a permanent pacemaker implanted postoperatively, you'll be coding an unplanned cardiac reoperation as well as the arrhythmia requiring the permanent pacemaker. And there's other examples, but these were some of the ones we get the most amount of questions on. Leanne, can you go to the next slide? So in addition to coding using more than one complication code, it's also important to remember that you'll be, for all of those examples and others, you'll also be checking yes to major complications in the patient process measures. And I just listed here the 6 different events that would qualify as a major complication. So it should be review for most of you, but just wanted to touch base because it does sometimes feel like it's kind of over coding, but it is appropriate in those examples. And there are some others to use more than one code for those events. Thanks, Leanne.
Great. Thank you so much, Leslie. I appreciate it. Again, if you guys have any questions regarding these coding of the complications, these double complication coding, just please let us know. All right, so next I'm going to turn things over to our IQVIA team for the IQVIA update. Mel, Joe?
Thank you, Leanne. All right, so first we're going to go into our upcoming updates for the September 2020 release. The date for that release is currently set to September 12th. So that will be coming in the next few weeks. So we'll start off with some issues regarding the missing variable report that will be corrected on that date, starting with STS 3356. The missing variable report is incorrectly flagging status at 365 days after surgery as missing. So additional logic will be added to the MVR so that this does no longer get counted when it doesn't apply, and to ensure that it's correctly counted when it should be. STS 3389, this has to do with the chromosomal abnormality other specify field. For this one, it's the other specify field for chromosomal abnormality is flagged as missing, even when a value was submitted for genes with identified abnormality. And so while the specify field for chromosomal abnormality is truly missing, it shouldn't count against you on the missing variable report because the gene information should satisfy that in version 3.41. So that fix will be coming in September as well. Next up, the STS 3501, the CHSD dashboard. For this, we received a request for the MVR not to count operative mortality as missing if the patient is still in the hospital. So we are going to be adding some logic to add this functionality to that report. And then finally, STS 3641, the op type section is no longer appearing in the dashboard. So that is going to be fixed on that date as well. Next, we have issues under review. And so these are things that have been reported and are still currently under investigation. Starting off with STS 3166, the logic for this bug has to do with the anesthesia adverse event error appearing, even when the anesthesiologist present is set to no. This should now be resolved, but if you do experience any difficulty with this, please do contact us. But the logic for that fix has already been implemented in the system. Next, we have STS 3499. This is another one that has been resolved. The user, for this, the uploader is triggering critical errors stating that the primary diagnosis indicator is required when the DAT file does provide that information. And so that should be working as expected. If you do, again, as with the other one, if you do find that you're still having trouble with that, please let us know so that we can look into it.
Actually, Joe,
Yep.
Sorry, can I jump in? It's Melanie.
Yeah, sure.
No problem. So on that one specifically, and we also flagged that it was not impacting all sites. For this specific example that got logged as STS 3499, that DAT file, it did not include the primary diagnosis flag. So it actually had the field blank. So we did have to notify the user, but in that instance, the user was advised to contact a vendor to identify what happened for that record of why the identifier wasn't supplied.
Thanks for clarifying.
No problem.
All right, next up we have 3527. This was an individual user situation where the uploader was reflecting an incorrect number of records processed following a submission. And so it was flagging records that had not been updated as skipped. Records that had not been updated were not skipped. And so we were looking into that. But again, this was just an individual user's DAT file submission. So we were looking into that. It was not something that we found to be impacting multiple sites. Next, we have STS 3560, the surgeon name displaying as missing. For this, we did receive a report where only some records for a specific participant were coming up as missing for the surgeon name, even though that information was present on the case form. This is currently under investigation. It does seem to only be impacting a few entries, not all of them, and so we are looking into that. And again, it's so far as we're aware, this is impacting one site and some of their entries, not all of them. So that is something that we are investigating. Next up, STS 3565. The CPBTM and some other data elements were identified as not showing up in the MVR, even though they were missing on the form. And so we were looking into that. Next is STS 3523. The intubation date and time error. So this is another one that was not impacting everyone. We did have a user report that an error where the system is saying that for one record specifically in their file, that the intubation date and time provided cannot be later than the current date, even though it did appear to be within the appropriate time frame. And so again, this was just a single record for one site submission where we did notice this. But for any of these where we're saying that they're only impacting one site, if you have experienced the same thing, please let us know and we can look into your situation as well. Continuing on, STS 3407. The MVR is indicating that the fourth model number for the valve explant is missing, even though the user indicated that there was not a fourth explant. And so we are looking into getting that corrected. STS 3225. The autologous transfusion appears to be coming up as missing for records where it is present on the form. And so this is another one where we're looking into making updates to get that corrected. STS 3604. This had to do with site-specific questions. So we had one site reporting that certain data elements are flagging incorrectly on their MVR. The report is that it's catching some instances of missing data, but not others. So this is under investigation to look into whether there are any issues with the report in regard to the specific fields that that user identified. And so again, we had reports from the single site saying that some of their values seem to be off, but do let us know if you find that you have, if you believe that you're seeing invalid entries on the missing variable report. And then STS 3587, we have a couple of users that noticed that the transfusion of blood products after 24 hours post-procedure, that data element is being flagged as missing, even though it is completed in the vendor's system. It also seems to be giving a greater than 100% missing rate. So we are investigating that report as well. All right, next slide, please. And I believe we are going to turn things over to Melanie for the remainder of the IQVIA updates.
Okay, thanks, Joe. So we did have one issue that we wanted to raise back because initially it was identified as being fixed in a release that we did previously, I believe on August the 1st, and that's STS 3249. And so this is where the uploader was triggering a critical error on the field that's listed here, and that was related to decimal values that were being uploaded in the file. So we have, and this was as of this morning, we were able to identify the specific root cause. So we do have a patch release that is going to occur this weekend, which will include an updated script that will do the action of clearing mappings. But In the meantime, if this is an item that you would like to have a workaround for, we do have a workaround that is available at the moment. And so the workaround is if you've encountered this actual error and you're not able to upload the fields, and it's basically saying that the decimal value is not being accepted, in the uploader interface, at the time of when you attach your file, you'll see that at the bottom we have a screenshot. It's going to show you the option to remove the file or upload the file. And then of course at the very bottom, it's going to show you the selected file name. The very right of the interface, you'll see that there is a button that's called Clear Mappings. If you select Clear Mappings, that will allow you to clear the set mappings that are there, and this is fine for you to proceed with. So you would take the steps of selecting Clear Mappings. It's going to ask you to confirm to clear the mappings. You would say okay. And that basically will reset all of the mappings and you could proceed with your upload. Okay, so what's happening now is that the settings that are looking at that specific data field, it's basically still holding. It's not taking the fix that was in place. It didn't refresh. So by you taking the step manually, you would reset that and it will then update the fields. And so you could take the action as of today to do this, or this weekend we will be proceeding with doing a patch update, and that will be happening Saturday. And so after that update is applied, you'd be able to proceed and do your upload and not encounter the error messages. So just wanted to let you know that you at least have this workaround available, but we will have a action that will occur this weekend to clear the mappings automatically in the system, and that will happen this weekend. Okay, so let's go to the next slide. And so we do have some enhancements that also will be included in the September release that's scheduled for the 12th that Joe reviewed, those items that will be fixed. So we do have enhancements that will be related to the MBR and the dashboard. There's an update that we are renaming or updating the label for premature birth. And basically that's going to give an additional verbiage that will say that it applies to neonates and infants. And then we will have new reports that will be available. And that's the case eligibility for inclusion for mortality analysis and the primary procedure mismatch report. Previously in the PDF DQR that you received, in the past it was primary procedure determination. So you will be able to see that information within that report of seeing what was submitted within your data file and what is the recommendation based on the different inclusions, exclusions, and of course verifying that the highest stat score has been selected for the code for the primary procedure. So you'll be able to see that information in the report. Next week, we do have it slated where we will be able to start sharing demos of those reports. So that will happen in the next time that we meet. I thought I would have been able to get some screenshots, but I wasn't able to get those within the environment. It was not ready. So, but we will have more information to share in the next session, and we'll be able to start demos at that time. So this slide is just to, of course, just again go through. We can actually start putting checks next to these items where we will be delivering those reports in September. And then, of course, once the harvest close, and then we are able to submit the data over to DCRI for risk adjustment, we will then be working with them to receive that data back and then provide the results in a risk adjusted dashboard. So that is going to be our future report that will stay on this slide. Okay, so I think that is the last slide for me, and I will turn it back over to you, Leanne. Thank you so much.
Great. Thanks, Melanie. Thanks, Chastity, Leslie, everyone. All right, next, everyone is familiar with these slides. We have the IQVIA support plan. As you know, here is the IQVIA contact information for tech support. We have the email address as well as the phone if you prefer to speak with someone directly. Live support is available 8 a.m. to 8 p.m. Monday through Friday. As always, when you initially contact IQVIA, you'll be connected with Tier 1 support. Tier 1 support will work with you and either answer your question. If they're not able to assist, then you will be routed to Tier 2 level support for follow-up. If with IQVIA tech support, or you'll be directed to the STS, depending upon the nature of your question. And again, Tier 2 will respond accordingly, as well as STS. STS will work with DCRI if necessary. If your question is analytical in nature, we will work with DCI to get a response, and we will respond. STS will respond directly to you if necessary. For our next slide here, we have just a listing of resources available to you. We have our STS National Database webpage. We have our tech support at IQVIA phone support, IQVIA phone support. We also have the STS National Database feedback form that we do encourage you to use. Please give us your feedback, good and bad. Let us know what we need to improve upon. Let us know what's working, enhancements that you'd like to see on the dashboard, future reports that you may like to see. Again, please feel free to use that National Database feedback form so we can share that internally as well as with our IQVIA colleagues. And it also allows us to track requests for enhancements and things of that nature. Out on the STS National Database webpage, we have our resource documents. You can find directly, actually mainly the best page I would start with would be the database transition resource page. You can find all the contact information, webinar information, FAQs. There's a go live checklist, as well as our support documents, training videos, linked to IQVIA and such. As always, here's my contact information. Please feel free to reach out to me directly with any questions or concerns that you have. You can reach me via email at ljones@sts.org, or you can reach me directly at 312-202-5822. If you have operational questions related to access to the dashboard, if you all need to update contacts within your organization, anyone needs access to the dashboard, you have questions regarding your participation agreements, please feel free to reach out to us at stsdb@sts.org, and we are happy to help answer any of those questions. As always, you can feel free to reach out to me initially. If I can't answer your question, I'm happy to point you into the right direction for assistance. So again, several ways to reach out to us here at STS for assistance. All right, our next webinars, please be sure to mark your calendar accordingly. Our next user group call is August the 25th at 12 p.m. Central. And as Mel stated, sounds like the IQVIA will have maybe some examples or screenshots to be able to share a little bit about the upcoming primary procedure determination report, as well as the case eligibility report. So be sure to mark your calendars and join us on August the 25th for our user group call. Our initial new data manager webinar is scheduled for August the 27th at 11 a.m. Central. And again, we do encourage any of our new data managers to please join us for that webinar. And our second user group call for coming up soon is September the 8th at 12 p.m. Central. So again, we please do encourage you to mark your calendars, and please be sure to join us for those calls. That is all that I have. I'll turn things over to you all for our Q&A portion of the webinar. Please feel free to submit your questions. And then we will go ahead and get started. All right. I see some questions starting to come in, so if the team's ready, we'll go ahead and start tackling our questions. Our first question, why won't we get an analysis for January 1, 2016 through December 31st, 2019? What about the U.S. News and World Report Survey? The questions on this survey are typically requested data tables from the spring harvest reports. The task force did decide that since we were having one harvest for this year, that harvest analysis will be conducted on the 4-year period of 7/1/2016 through 6/30/2020, which follow the fall harvest analytic period. U.S. News is aware of the STS plans, so they are aware that we are not conducting the spring analysis. We will be the 4-year report will be based on the typical fall reporting period. So we do expect U.S. News probably to address the reporting period and their questions set to be asked, but we do encourage you to work directly with U.S. News if you have any questions about what the upcoming survey will look like. But again, U.S. News is aware of the STS plans for the current harvest for 2020. All right, our next question, whenever updates are applied at IQVIA, what is required from centers that are submitting? Do we need to resubmit? It's a great question, Dawn.
It's a great question, and it's Melanie. I'll answer this one. So for this update that's being applied, nothing is required for the centers that have not encountered this issue, right? With that specific issue that I referred to earlier, they're encountering a critical error, so the record is not being saved to the database. So once we have that, either if the workaround is done, you can do your upload. It will then accept those records that were encountering that critical error. If you wait until we do the patch, which will occur again over this weekend, you would just resubmit your records that were encountering that specific issue. If you did not encounter that issue, then there is nothing for you to do. Your records were accepted in. Those users that reported the issue were encountering a critical error when the data included for those fields a decimal. So you should not, if you didn't encounter that issue, you will not have to do any resubmission for that.
Okay, thank you, Melanie. Our next question, does IQVIA have a checklist of things we should look at before we finish our final submission? Thank you. If not, thank you. If not, it's a good idea if we could produce one. So I know, go ahead. I don't know if you wanted to chime in first, Mel.
Well, I'm not sure in regards, so we've always had given the guidance of the steps that you're doing when you're submitting your data is, of course, you would do your upload, then review your DQR to review that specific submission. And then the next step after that is, of course, navigating over to the missing variable report to then review what are the variables that are being flagged as missing, reviewing that. And then the next step would be if you wanted to look at a holistic view of the data that's been submitted, you would then review the errors and warnings that for a specific surgery time period rather than looking at it by submission. So the next step would be review the harvest summary. Make sure that if there are errors or warnings that you need to address there, you would take a look and make sure that all of that information is reviewed. But other than that, it's going through and just iterating through the different, those steps, and hopefully that helps to clarify kind of the process of reviewing the data. And then of course, looking at the dashboard, then you're able to take a look at specific sections and reviewing to see the op type, which we're bringing that back, but being able to get your counts and reviewing that, making sure things align there. But that's what I would recommend in regards to navigating within the system. Is there anything else, Jeanette? I don't know if Jeanette, are you on? Is there anything that you?
Yeah, I know we've also gotten some feedback from users that you would like an opportunity to review the 2 upcoming enhancement reports. So Leanne, if you could go back in the slides to those 2.
Yes, ma'am.
So those have been confirmed by many members of the community as something that you'd like the chance to review before your harvest closes. So similar to see these 2 reports, so the case eligibility for inclusion and mortality analysis and the primary procedure mismatch report. Those we would also encourage you to take a look at near the tail end of your harvest review after you are feeling good about the information in your data quality report or DQR and the missing variable report or MVR.
Great. Thank you, Jeanette. And we just had a request. Can you make a workflow or checklist and post on the IQVIA website for new users? That's also something that we could include in our within our new data manager webinars as well. Some type of workflow and checklist for our new data managers as well. Just a thought.
Yeah, I think this is Carol. I think that's a great idea, Leanne. We can work we can work with the core group and maybe come up with that list to share with everybody. I think that's really helpful.
Yep, that's a great idea. Thank you. Our next question, will the report for the analysis of the fall harvest only be available on the dashboard, or will we get a copy emailed to us? No, we won't have any more of the PDF reports like we did in the past. So once the analysis is done, there'll be the risk-adjusted dashboard that'll be available to you. So everything will be online within the dashboard. And we will be providing educational webinars on how to use the risk-adjusted dashboard when that data does come back from DCRI and it is uploaded into the IQVIA platform. So we will be covering, having webinars on how to use the risk-adjusted dashboard and how to interpret the analysis. So that will be coming. Our next question, will we be able to see our overall missing data percent that would keep our site from being included in analysis? And I believe Angie's referring to the case eligibility for that. I think that would be covered in that case eligibility.
That will be available there. That's correct.
Okay, our next question, the mortality follow-up date is automatically applied to all cases in a patient's record. On the dashboard, this field indicates the patient was dead for a previous hospitalization because the current hospitalization indicates the patient died in-house. Seems like the mortality is being applied to a previous hospitalization a year ago.
I think we would need to review that further. I'm not 100% sure. I know that we have an update that's going to be applied to the dashboard where we are excluding patients that are still in hospital. But I haven't heard anything in regards to this before. So we would need to see the specific example. So hopefully, and maybe you've already submitted this to the support team so that we can.
Question does indicate it was submitted. So thank you very much for reaching out about that.
Okay.
Yep.
All right. Perfect. Thank you.
All right. Our next, I don't have any other questions coming in. So I'll just throw up our next database webinar scheduled so everyone can review that. Please, if you have any questions, Autumn was just clarifying that she had submitted the FAQ for the previous question, not the mortality question. So Autumn, thank you. Autumn was referring to the anesthesia question that she submitted that as an FAQ, but she has not yet submitted that mortality question. So Autumn, if you could submit that question regarding mortality to IQVIA, you could follow up with support so they could log that concern and work with you on your specific question regarding that mortality that you're seeing, that mortality information that you're seeing in the dashboard. Our next question we have from Beth, will you be able to save information from the reports from the dashboard? I do refer back to prior reports to compare past data with current data and would like to continue the ability to do so. I don't know, is anyone from our IQVIA team on if they want to?
Jeanette's here. So you will be able to print or export the reports. You can print or export the existing reports within the system. You have the option to do Excel exports on the tables or to print the report to PDF or in some instances PowerPoint. So you will have that ability as well on the risk-adjusted dashboards when those are available. And you will also have that option on the two new reports that we were discussing just a little while ago as items that you could review before your harvest closes. So printing and exporting those reports would be the way that you would save those off for future reference or for sharing with colleagues who may not have access to log into the system directly.
Great, thank you, Jeanette. And also, I know we don't have any other questions, so just to give everyone an opportunity to maybe if you have one or two more questions that you wanted to ask in the meantime, I wanted to bring to everyone's attention we are getting geared up and ready for our next upgrade for the congenital database. Our next upgrade is set to go live in January of 2022. So SPS staff as well as IQVIA are getting ready for that upgrade. If you have any suggestions for the upgrade, things that you don't think that are working well in the data collection form or things that you'd like to see, any ideas, please feel free to email those to me directly. I'm happy to share those with our surgeon leaders as we work through this upgrade. Also, if you have any ideas on the training manual, I'm looking to make improvements for our next training manual to make it a little more data manager user friendly. So if you have any comments or suggestions on the training manual, would love to hear those so I can make sure that that training manual is beneficial for you all and is very useful. Again, so please feel free to share your ideas with me for the next upgrade as well as the training manual. I would love to have any of your suggestions. Carol, did you have anything you wanted to add regarding the upgrade or training manual or process?
No, thank you, Leanne. I think that you covered it well.
Okay. All right, we have one more question. Let's see here, Mel. On the upcoming mortality eligibility report, will the report indicate which of the pertinent fields caused the case to not be eligible?
We will have drill down capabilities. It's going to give you the cases, and there are only specific fields that will cause that case to fall into an ineligible status.
And
So
those fields will be listed in a sort of a footnote so that you don't need to go look up that list separately.
Correct. So you will have the ability to see that information within the report.
Yeah. Great. Our next question, since there's not going to be a PDF report, where would the data in the intro be for reference? And Janet's referring to the report overview and interpretation guide. Where will those be held within the IQVIA platform?
Those will be posted in the library. So it's under the left-hand navigation, you see that there is a section for resources. Underneath that area is library. So it will be posted there.
This is Carol. Just to clarify, they are not posted there yet, but they will be.
Thanks for clarifying that.
Yeah.
Yes.
Correct. And also in regards, speaking of resources, I know Melanie and team will work. We also, IQVIA does have the issues under review typically posted within the platform, so you can refer to, I believe it's held in the resources section, Melanie.
Notifications.
Notifications. Thank you. Sorry about that. Okay, yes. So our current list of issues under review will be posted in the notification section. So you can refer to that as you're going through the current harvest. So you can refer back to that until the next release slated for September 12th. I'm not seeing any additional questions come in. I don't know if anyone had anything they wanted to cover or bring up. Let's see here. There's one more question. Will the harvest reports also contain the information on the benchmark procedures? Yes. So yes, that the benchmark procedures will also be included in the risk-adjusted report. I don't know if, like I said, if anyone had anything else they'd like to cover that I may have missed or bring up. Anyone? All right. Since I'm not seeing any additional questions come in or we don't have any other topics to cover, I want to make sure I'm respectful of everyone's time. I just wanted to thank you all for joining us today. And again, please feel free to reach out to me directly if you have any questions or concerns that you'd like to discuss. My email address is here on the screen. I'm sorry, it's not on that one. It'd be helpful if I shared the right one. My contact information is here on the screen. Please reach out to me directly with questions, concerns, feedback. You can reach me at my email or my phone. So again, please reach out. We're here to assist you, and we're here to listen. So please reach out to us with any questions or concerns that you have. I just wanted to thank my SDS team and the IQVIA team, and Chastity and Leslie as well for their assistance today. I hope you guys all have a great week. Thank you all for joining, and we'll chat on our next user group call on the 25th. So we look forward to chatting with you all then. Thank you, everyone. I hope you all have a great day.
Thanks so much, everybody.
Thank you. Thanks, guys.